Is AI the real deal in healthcare, or is it just hype? Well, if you ask the clinicians and administrators that are here attending the 2025 Oracle Health Summit, they would say AI has definitely been beneficial. And I gotta say, that has been consistently the answer that I have received from everyone I have spoken to so far. In this video, I'm breaking down all the important news, from groundbreaking AI agents to robots moving supplies around the hospital. Stick with me, because you'll definitely want to hear what one physician told me after just one day of using Oracle's new clinical AI agent. I'm Colin Hung, and I've spent the last 2 days here at the Oracle Health Summit listening to keynotes, talking to company representatives, and of course, to Oracle Health's customers. Now, full disclosure, Oracle did invite us down to cover their event, and they've paid for a portion of our expenses. But they have not had any input into this video and have no idea what I am about to say. This year's Oracle Health Summit was packed with announcements. They announced the company's further investments in AI, about all their new partnerships to fix the payer-provider gap, and deeper integration with the rest of Oracle's product suite. The summit opened with a clear message. Oracle wants to embed AI into every corner of their product and of healthcare. From payer-provider automation to supply chain robotics to matching patients with clinical trials within the EHR, their announcements covered a wide swath of the healthcare industry. One of the biggest announcements was the launch of Oracle's AI Center of Excellence that will include a healthcare clinical store. And here is Seema Verma, Oracle's Executive Vice President and General Manager of Health and Life Sciences, explaining how that works.
And so what we know is that there's innovation going on all over the globe, but we have problems sharing that, right? So if we have great quality care at one institution, we know that people want to share best practices, and that's become very, very difficult. We know that other competitors will say, hey, the IP belongs to me, and sometimes they'll deploy it across the enterprise and sometimes they won't. We really want to give freedom for our providers to be able to share best practices. So it works in a couple of ways. So any of our customers, working off of our AI platform, they can build their own AI agents, so they can share those AI agents, and they can also share some of their clinical pathways or best practices. It could be, how to triage in the emergency room, or here's a better way to treat a diabetic patient. And so you'll be able to shop around for those clinical guidelines, and you can actually compare those based on quality, outcomes, and cost. And so I think it really provides an opportunity to create that sharing. And so for providers on the front lines, if they're looking at something that they haven't seen and they need help and they want to see what's the latest and greatest, they can decide what workflow or what clinical guideline to use. And the great thing about our solution is that it allows for it to be easily adopted and to be put right inside the clinical workflow. So I'm really excited about this because I think that this is going to raise the quality of care across the entire globe.
Seema also addressed one of healthcare's most persistent pain points, the friction between payers and providers. Oracle is betting that AI-powered automation can finally cut through all the delays regarding prior authorization.
We're trying to solve the greatest challenges in healthcare, and that we know the friction between payers and providers is a pain point on both sides. And also it's actually contributing to a lot of the administrative costs, and you heard that on some of our panels today, that 25 to 30% of the healthcare dollar is just going towards administration. There's a lot of back and forth. And so this new product that we're bringing to market is supposed to try to reduce that friction. Prior authorization is something that's not going to go away. Payers see it as a necessary tool to make sure that evidence-based care is being delivered. And so they're always going to do this, but there is a way to automate this to make it easier so that it doesn't take a lot of back and forth, and so that the payer has the information that they need. And also providers, they know instantaneously whether a prior authorization is even needed. We know a lot of times they're sending prior authorizations that are not needed. And if it is required, that the correct information is there so that the prior authorization request can be completed and can be approved. And for some reason, if it isn't likely to be approved, we're also inviting payers to suggest an alternative treatment or therapy. So the idea here is to create more automation of the process to make it easier for payers and providers to reduce the cost and reduce the friction. And ultimately, for patients, that's going to mean that they're not going to have delays in care. And I think that's really an important component of this as well.
And it wasn't just about clinical care here at Oracle Health Summit. The company also announced new modules on the operations side. Kristin Miles, VP of Product Strategy, explained how Oracle is bringing lessons from retail and logistics into healthcare.
We have continued to invest for healthcare in our supply chain application. So we've got some exciting new things around automation with RFID technology, robotics automation and integrations, as well as advanced inventory capabilities that really help our healthcare customers manage their inventory, understand when shortages are predicted to happen, things that today, well, previous to today, they couldn't do. That was somebody manually looking at spreadsheets or just hoping for the best. If you think of inventory, it's going to be your commodity type supplies, your PPE, your gloves, but it can also be those heart valves that are needed for a surgical procedure, implants, etc. So it really spans the gamut. Folks keep lots of things in their inventory.
For the past 2 years, Oracle has said that they want to be the system that works for providers instead of against them. And let's be honest, a lot of legacy EHRs work against clinicians. Well, Billings Clinic is one of the places where Oracle seems to be living up to that promise. Dr. Randy Thompson told me how AI-generated patient summaries are transforming chart reviews.
I feel for the first time that the system, the HR, is really finally starting to work for us. Really, that's the theme, my theme for this conference. And I'll give you an example. So with the new EHR, these AI-generated patient summaries and the conversational queries are really revolutionary. So the system, the EHR, goes out and searches through the database, extracts the relevant information, synthesizes that, summarizes it, and presents it to the provider in a very concise, readable format. So the provider can actually focus on the information rather than getting the information. And an example of that is a patient who had coronary artery disease on their problem list. So the problem-based AI-generated summary went out, searched the database, found information from 11 different sources, brought that back, synthesized it, and presented it in a very readable format. And so it's unimaginable the amount of time that a clinician in their busy schedule would be able to do that.
At Hudson's Physicians, Dr. Ryan McFarland is beta testing new Oracle AI features that propose orders and referrals in real time, taking their documentation and automation one step further.
Fortunately, I'm heavily involved with beta testing some of their more products. So we're beta testing their orders entry. So the AI agent, while listening to us, is proposing my medications, my labs, my imaging orders, referrals, return to clinic, all proposing that for me. And then also professional fees, where it's recommending levels of service and putting that in for me as well. And then the new EHR, the AI-enabled EHR is, I mean, it's the icing on the cake. That's really what we're waiting for. Is that, because that really encompasses all the products we've already talked about and really makes it work well together. But you know, it's more efficient. And again, I'm not forgetting to put in that CT I talked about. I'm not forgetting to order their colonoscopy just because I didn't click the button while I was in the visit. It's getting done. Again, the AI doesn't get tired. It doesn't forget. It's proposing those things for me.
Announcements are one thing, but what really matters is how these tools are working inside healthcare organizations. And here's what I heard directly from some of their providers. At Beacon Health, the impact was immediate. One physician told Dr. Scott Eshowsky that after using Oracle's AI Scribe for just a week, she finally got her Sundays back.
Literally within one day of one of my partners using it, she was almost giddy with how she could tell even after one day it was going to improve her quality of life. And that following week, her comment was, I'm going to need to figure out what to do with myself on Sunday afternoons because I don't have to chart anymore. And that one really it resonated with me because this is exactly what we wanted technology to do, which was to give providers their lives back, or at least a portion of their lives back, so that they're able to spend time with friends and family, take time on the weekends to recharge, not have to spend their evenings catching up on charting. And it seemed to do that for a lot of our providers.
Dr. Eshowsky also noted that patients themselves are noticing the change. More eye contact, more listening, and less time for the physician behind a keyboard.
So I would say the overwhelming majority have been accepting of it, and I think as time goes on, this is going to become our norm, and patients are just going to expect us to use these tools. On the flip side, they have really enjoyed us being able to push the computer aside and have a conversation with them face to face instead of having our faces buried in the computer while we're listening.
Over at Hudson's Physicians, even the skeptics came around quickly. One veteran doctor called his first AI-generated note the best he's done in over 40 years.
So a good example is we had a older doc, he's semi-retired, just working 1 to 2 days a month. And when we implemented, he's like, I'm not going to use that. I've been a doc for 40 years. I'm just going to keep writing my note. And one of our team members said, here, just try it. Download it on his phone for him. And he looked at it and he goes, well, what do I do? She's like, hit the record button. Hit the record button, went in the visit, came back out, and he's like, now what do I do? She's like, hit the end button. And he's like, okay. And then, within a minute or two, the note came back. He's reviewing the note, and he stops and goes, well, this is the best note I've written in 40 years. And that was the end of his resistance to using the product. And it's been implemented widely within our group.
And at Billings Clinic, Dr. Thompson says the technology isn't just saving time, it's helping clinicians reclaim their work-life balance.
Before CAA, she would really struggle to keep up on her notes. She was a busy clinician, a busy mom, a busy caregiver for her family, and so she never got her notes done before she left. She was documenting late at night on the weekends, was on the delinquent chart list, and just had a really less than optimal work-life balance. So her very first day of using CAA, she was done with all her notes, out of the office at 5:30, and she said that had never happened. So she was contemplating reducing her FTE just due to all the demands, but she said she's no longer contemplating that. She's off the naughty delinquent chart list. She has a better work-life balance, better job satisfaction, so it's really impacted her in a very positive way.
Now, this wouldn't be a recap from me if I didn't mention that there were many Oracle partners in the exhibit hall. And I had the chance to speak with several who had interesting announcements and new capabilities. All of them were very happy to hear about Oracle's continued commitment to openness and being partner-friendly. Look for my other video summary with those partner conversations. What are my key takeaways from the 2025 Oracle Health Summit? Well, there were 3. First, Oracle is flexing their Oracleness, and in a good way. They're bringing their considerable experience and broad solutions in finance, logistics, ERP, and HR from other industries to healthcare. The message here was clear. If you go with Oracle Health, you're choosing a platform that can help you in all these other parts of your operations. Oracle Health's customers don't have to wait for an ERP. They can have it literally tomorrow. My second takeaway, Oracle is serious about embedding AI into everything they do, from prior auth to supply chain to the patient portal. Last year they said they were going to go all in on AI, and this year it showed. My final takeaway, Oracle customers are seeing tangible benefits from AI, and they are all enjoying their collaboration with Oracle. Now, there are still some questions to answer around AI, like governance and integration. But at this year's summit, Oracle has shown that it has created a realistic and achievable path forward for all its healthcare customers. A path that many of them are already on. So that's my take from this year's Oracle Health Summit. If you want more of the conversations like these, check out the full interviews with all the people I mentioned. They're in the links below. I'm Colin Hung. Thanks for watching this, and I'll catch you on the next video.